Good morning. My name is Jason, and I'm with Focus Counseling and Therapy in Daphne. And I want to talk today a little bit about therapy and clarify exactly what it is and what occurs in therapy, because there's a lot of misconceptions. I'm not going to tell you who I do therapy with, obviously, but I am going to talk about some of the top issues that I run into. Now, first and foremost, it is going to be relationships. Very common. It's usually where one or two people within the relationship have really forgotten how to communicate to the other. Over time, they've grown apart. Maybe they have forgotten why they fall in love in the first place, and conflict arises and they're not sure how to handle it. Conflict's another big one. A lot of times people aren't sure exactly how to handle conflicts or to avoid them or to manage them in a way that they don't escalate. There are people who may have grown up in less than ideal conditions, to put it nicely, to where they have a very distorted image of themselves, distorted images of the world and how they fit into the world. And we work with them to develop a sense of identity of who they are so they can move forward in their life. We work with a lot of people who may have a sense of general anxiety because of perhaps of what they've gone through, or perhaps of the unknown, or they just feel overwhelmed in life and it seems like it's just too difficult to handle, so they feel stuck because of the anxiety. Yes, you got depression. People come to us being depressed over certain things, whether it's the grief of a loved one, loss of a job, the loss of a friendship, whatever it may be. And we work with them. We get to know them. We develop empathy for them and care for them and come up with plans where we work together so that those dealing with these various struggles in life move forward. A therapist is not going to fix everything. It just isn't. And a pill is not necessarily going to fix everything. Of course, it may lower certain symptoms like with anxiety or depression. But if you want to put it in a nutshell, someone walks into therapy with these issues, and the therapist is right there with them, and the therapist is there to truly listen, because in a therapy office, it's one of the few places where you have complete confidentiality. You can talk about anything. You can talk about anyone, and you're not going to be judged because the therapist is there to help you to adapt, cope, overcome, and move forward. And that's what a good therapist does. A Another reason why someone comes to see us is because they develop bad habits, whether it is eating disorders or utilizing of substance. And we will work with them to identify why they do that in the first place, and then how to overcome it and move forward once again. So it's not this mystical or people who are coming to see therapy are crazy or whatnot. It's just people like you, people like me, who sometimes in life can feel stuck because of certain life circumstances that has been imposed upon us or we have found ourselves in, and we're not quite sure how to move forward. We need a plan. We need someone on our side that's going to give us non-biased guidance, to give us tools, to give us techniques, to be there to work with us, to push us forward in our life, to get us where we want to be. That's what I enjoy about being a therapist, because I have seen many lives now changed strictly because of individuals gaining deeper insight within themselves and within their relationships through the therapeutic relationship that we have. And that makes it worth it. That is what makes it work. And that is an amazing thing to see. If you want to learn more, you can Google my website at jjohnsoncounseling.com, or you can call me at 251-307-5338. I thank you again for listening, and I hope that you have a great week. Take care.